500 members of the Oregon National Guard are now helping out on the front lines of the pandemic. They were deployed this weekend to support hospitals around the state as they deal with a summer surge of COVID-19 cases. Fox 12's BRIDGET CHAVEZ joins us live from Northwest Portland with more on what troops are doing to support our healthcare workers. BRIDGET?
Yeah, Camilla, that initial deployment of those 500 Guard members began yesterday, but the governor has authorized up to 1,500 members to help serve in hospitals as they fill up. As Oregon's hospitals fill up amid the current COVID-19 surge, hundreds of National Guard members are now activated and filling roles in hospitals around the state. Anthony Hess is the on-site commander for Asante Medford. He says Guard members are providing logistical and non-clinical support for frontline healthcare workers.
What that really looks like is a variety of different jobs. So we look at screeners, we look at couriers, lab couriers, traffic control, runners, and security officers.
Hospitals across Oregon are on the brink, and the Guard is positioned to provide support to more than 20 hospitals across the state. This initial deployment puts 500 soldiers on the ground, but we could see up to 1,500 activated depending on what hospitals need.
Really, Asante is just very exhausted on the resources for various different reasons. Where we come in is supporting those roles where a CNA or a PA or an RN might be filling right now because they're low staffed, and we get to come in and support those needs so that those other highly trained nurses and doctors can then be utilizing their original capacity.
Hess says most of the Guard members there are also from Southern Oregon.
It just rings close to home as we're here now. We're actually being utilized, and the soldiers get to wake up in their house and go home to their families, but also serve on active duty and represent the Army National Guard in uniform at Asante.
But this activation didn't come without challenges.
Telling those families and telling those supervisors that they have to be utilized and leave and go away from them. So I think that's the biggest challenge is the employers and the families just making that sacrifice to let us go and support the hospital because the need is obviously there.
And Hess tells me that their orders extend to September 30th, but that could change depending on the need. Reporting live in Northwest Portland, BRIDGET CHAVEZ, Fox 12 Oregon.